Welcome back to Strength Foundation. Today, we're diving deep into one of those critical chapters, Chapter 22, all about clients with special neuromuscular conditions.
Okay, let's get right into it. This stuff is guaranteed to be on your exam, and knowing it isn't just about passing, it's about being a safe, effective trainer. We're going to break down 4 key conditions: spinal cord injury, multiple sclerosis, epilepsy, and cerebral palsy. So let's get you totally prepped to crush this part of the test.
First up, we've got spinal cord injury, or SCI. And to make this stuff really stick for your test, we're going to use a super simple framework for each condition. It goes like this. First, we understand the condition itself. Second, we lock in the number 1 safety caution. And third, we figure out how to apply the coaching. Simple, right? Okay, so to really understand SCI, you've got to know the 2 main classifications you'll see on the exam. On one side, you have tetraplegia. You might also hear it called quadriplegia. This happens when there's an injury high up the spine, between C1 and T1, and it affects both the arms and the legs. Then you've got paraplegia, which is from an injury a little lower down, and that impacts the lower half of the body. The big takeaway here? The level of the injury tells you everything about the potential impairment. Okay, now listen up, because this next part is maybe the most important thing for both the exam and, real-life client safety. The number 1 thing you need to be aware of is a life-threatening condition called Autonomic Dysreflexia, or AD. This isn't just a concern, it's a full-blown medical emergency, and you have to be able to spot it immediately. So take a good look at this slide. You're going to want to burn these signs into your brain. The absolute classic sign of AD is a sudden, crazy spike in blood pressure. We're talking 20 points or more. It usually comes with a nasty, pounding headache, maybe some blurry vision, and you'll see flushing or sweating on the skin, but only above the level of the injury. If you see these signs, the workout is over. Stop immediately. So, how do we coach these clients? Well, it all comes down to following the evidence-based guidelines. And right here you can see the exact parameters. For cardio, the goal is getting over 30 minutes of moderate work 3 to 5 days a week. For strength, it's at least 2 days a week. But here's a pro tip for the exam. Look closely at that note about focusing on scapular stabilizers and rotator cuff muscles. That's a huge detail because shoulder injuries are super common in this population. All right, moving on to our next condition, multiple sclerosis, or MS. And we're going to tackle it with the exact same framework to keep things simple. Understand, caution, and coach. So what exactly is MS? Well, it's an autoimmune disease. That means the body's own defense system gets confused and starts attacking the protective covering around its nerve fibers, which is called the myelin sheath. I want you to think of it like the plastic insulation on an electrical wire. When that gets stripped away, the signal just goes haywire. And that's what causes all the symptoms. Now, one of the trickiest things about MS is that the symptoms are all over the place, and they can change over time. This table here does a great job of showing how things can progress. Early on, a client might just mention some vision issues, or maybe some numbness and tingling, but later, that could develop into more serious challenges like muscle weakness, brain fog, or really intense fatigue. The main thing to get here is that no 2 clients with MS are the same. It's super individualized. And that leads us to the absolute number 1 caution for training clients with MS. Seriously, if you remember just one thing for this section, let it be this: heat sensitivity. Even a tiny little increase in their core body temperature can make their symptoms flare up temporarily. So a cool, air-conditioned gym isn't just a nice to have, it's an absolute must for a safe and effective session. So when it comes to coaching, these guidelines are your playbook. You'll notice for resistance training, the big push is on functional movements. For cardio, you're starting with shorter 10-minute bouts and building from there. And check this out. Flexibility is recommended almost every single day. That's so important for helping manage muscle spasticity, which is a really common issue for clients with MS. All right, we're in the home stretch now. Let's knock out the last 2 conditions you need to know: epilepsy and cerebral palsy. We'll do a quick hitter guide on the must-knows for each one. Let's start with a situation you absolutely have to be ready for. Let's paint a picture. You're in the middle of a session with a client, and all of a sudden, they have a seizure. What do you do? Because, freaking out is not an option. You need a plan. Okay, this slide right here is your first aid cheat sheet. Your number 1 job, stay calm and keep them safe. That means you clear the area around them of anything they could hit, you loosen any tight clothing like around their neck, and 2 huge things to remember: Never try to hold them down or restrain them, and never put anything in their mouth. Your job is to protect them from injury until the seizure passes on its own. Okay, switching gears to cerebral palsy, or CP. There's a really key distinction here you have to get for the exam. CP itself is not a progressive disease. The initial damage to the brain doesn't get any worse over time. However, the secondary issues, like spasticity, which is that muscle stiffness, can definitely get worse if they're not managed well, and that's exactly where you, the trainer, come in.
So, what does that mean for your programming? It means every single thing you do should circle back to this one core idea: improving their functional capacity. We're not just building biceps here. We're training movements that make everyday life, getting out of a chair, carrying groceries, playing with their kids, easier and more accessible.
And here we go. This is your framework right from the textbook for building that program. You'll see recommendations for aerobic fitness, for muscular strength, and for overall daily activity. The big theme you see here is just regular, purposeful movement that hits all the major muscle groups. Really, the end game here is to build habits that help them stay active for life.
Seriously, if your brain is full, just take a screenshot of this slide. This is your ultimate cheat sheet for the test. For spinal cord injury, think autonomic dysreflexia. For MS, it's all about heat sensitivity. For epilepsy, you need to know seizure first aid cold. And for cerebral palsy, your focus is always on improving functional ability. Nail these, and you're in great shape.
You got this. Keep reviewing these key points, and you're going to walk into that exam feeling confident. Awesome job today.